Hoy regreso a un lugar que marcó un antes y un después en mi vida. Estoy aquí en la clínica del Dr. Rankin a visitarlo y abrir una conversación honesta sobre la enfermedad por implantes mamarios y la explantación. Muchas mujeres han venido a este lugar buscando respuestas y obviamente soluciones, ¿no? Y mi deseo, lo más importante para mí, mi deseo es que lo que compartamos, pues hoy les brinde claridad, esperanza y opciones reales. Thank you so much, doctor. I'm so happy to be here 2 years after, almost 3 years. We have a lot of ladies writing to me. So I wanted to start asking you the real symptoms when you need to really pay attention.
Well, there's so many symptoms that we see with breast implant illness. It's literally from A to Z. You can read through that for the most common symptoms, but we see anxiety, joint pain, brain fog, skin rashes, gastrointestinal issues, loss of hair. There's just really a whole list. And women should rule everything out like you did first. You went to other doctors, you ruled everything else out, and then we say, maybe this is the breast implants.
Again, how do I know what I have, what I'm feeling, my symptoms are related with breast implant illness?
Well, it's difficult because we don't have a test. You can't get blood work, you can't get an EKG or a ultrasound and say, oh yeah, I see you have breast implant illness. So it's really a process of elimination. If you've been to specialists, been to your primary doctor, done blood work and ruled out other causes, then you have to understand that your implants may be the cause.
So what can you say about the recovery itself? But when can you start seeing the effect of the explantation?
Yeah, like you said, some women, it's right away. It's almost immediately after surgery, and other patients like you, it takes longer. And there's a sort of a correlation with the amount of time you've had your implants, with how long it will take your symptoms to resolve. In my practice, probably 85-90% of my patients do feel much better after explanting. The timing, however, just depends on the individual. We don't quite know why that is.
How they're going to look after the surgery?
Yeah, well, of course, both are very important, health and aesthetics. So it's individualized. The best thing to do is to have a consultation, because it depends on size of the breast implant, amount of breast tissue, degree of drop to the breast, age of the implant. There's so many different factors that come into play. Typically, women with more breast tissue and a smaller implant, the aesthetics are a little bit easier. It becomes more difficult with a very large implant and very thin breast tissues. Final aesthetics usually take, I tell every patient, usually about 6 to 12 months of waiting time.
Thank you for helping so many women. It's good to raise our voices and awareness. I mean, it's the best decision I ever made. It was part of my journey, my healing journey. So I thank you so much. Thank you.
My pleasure.